This spring, heels, I know that you've been watching this, heels higher than ever. And when the heels get higher, it's so painful for us, but we will still continue to wear them no matter what's happening with our hips, our shoulders, our back, our toes, whatever.
Is a centimeter.
That's
maybe a centimeter and a half.
That's interesting.
Once again, when you say interesting, I know you mean shut up.
Dr. Suzanne Levine, a board-certified podiatric surgeon.
Hi. Good morning.
Nice to have you here.
Doctor, we have you here because the heels are getting higher and higher, and I think business for you is going up as well because people are injuring themselves with these ridiculously high heels.
It's true. I mean, heels are here to stay. It's the ultimate equalizer. It makes you look 10 pounds thinner, and we even saw this season.
How does it make you look thinner? I understand taller, but I don't understand thinner.
It makes the leg look longer, and it just immediately adds height. And by doing that, it just gives you the perception of being slimmer.
Are these some of your shoes? I just want to know.
Yes, some of them are my shoes.
You're styling. Okay.
But they are 2-hour shoes.
What does that mean?
That means you just wear them for 2 hours. If you wear them longer, you could end up with the knee problems, hip problems, back problems, and all these different injuries that we see, and also metatarsal pain, pain under the ball of the foot. And of course, we've been treating this. I have various techniques to keep you wearing your high heels.
How about a nice pair of sneakers?
Well, that's true. People do wear sneakers, but I've had patients that complain of having pain in sneakers. You end up with a plantar fasciitis or heel problems sometimes.
Is all the pain, all the suffering, all the surgery worth the...
It's worth it.
You think? Okay, you girls would know.
It's worth it.
Really?
And you have to take care of your feet. You have to treat your feet the way you treat your face. If you treat your feet the way you do your face, you would probably have pain.
So what should we, because listen, the bottom line is we're still going to continue wearing heels.
There's no question about it.
Okay, so what should we do to not be in so much pain?
Well, I think you have to moisturize your feet. You have to also exercise. There's certain exercises that I do. And if you have a lot of burning pain under the ball of your foot, like many of my patients, there's different procedures out there. It's infrared. There's some physical therapy. There's all kinds of insoles that you can wear in your shoe.
Dr. Scholl's.
Well, even Dr. Scholl's.
Magellan.
There's gel insoles. So there's lots of things that you can do. Use ice before you go out. You can apply various creams,
Before you go out, just ice your foot preemptively?
Yes, yes.
Interesting.
Yes.
I have to tell you, sometimes my feet hurt more when I'm in flat shoes than I am in high heels.
That's my point. That's right. You could have pain at the back of your heel, plantar pain, plantar fasciitis, and there's so many patients that have a lot of pain due to wearing flat shoes.
It's the foot. It's withdrawal. Is it withdrawal? Seriously,
it is.
Withdrawal.
It is withdrawal.
Really? Okay.
Yes. And what happens to the ligaments in the leg?
Well, that's interesting because what happens is we end up with problems usually at the knee, osteoarthritis at the knee, the hip, prolonged periods, back problems, and also shortened heel cords. Your calf muscles shorten. So never go from a very high heel shoe to a flat shoe. Otherwise, you'll end up in my office.
Doctor, these things sound like a public health menace.
But they're here
high
to
heels.
Stay. They're here to stay, and it's the equalizer.
And you wear them yourself?
Yes, I do, but this is the 2-hour rule. It's the Dr. Levine 2-hour rule of wearing high heel shoes.
All right.
And that's key.
Obviously, you're going to have to be toting around a lot of shoes if we listen to your rule, right?
Yes.
Well,
no. Just have some flats in your desk drawer.
Well, not flats. I wear 2-inch heels that I switch off to. Flats, you'll end up seeing me.
I am immune. As a man, I don't wear any of these things.
That's good. You have good feet?
Not bad, although I do have an ingrown toenail.
Okay, well, we'll have to see you for that.
Yeah. You do that as well?
Yes, I do that as well.
Dr. Suzanne Levine, thank you so much for coming on and sharing that information with us.
Well, thanks for having me.